Well, good afternoon, everybody. And it's once again great to be out of our State Operations Center and out in the community up here in Northern California in Napa County at Mustard's Restaurant. We are here to update you, as we do on a daily basis, as it relates to the current status of those hospitalized, those in ICUs, number of deaths, and the like related to COVID-19, but also to make some announcements in relationship to some additional modifications to our stay-at-home order. Let me contextualize as I stand here today where we are in this state as it relates to the broader trend lines, and then begin to unpack where I believe we will be going over the course of the next week, two, and then, of course, over the course of many, many months ahead until we have immunity, until we have a vaccine. We have 24 counties currently in the state of California that have self-attested, certified with containment plans, with protection plans that we have put online as regional variants to the statewide stay-at-home order. 24 counties have self-attested. We announced the self-attestation process on May 7th. Many counties began the process of organizing, and we saw a first number of counties, Butte County and others in Northern California, begin that process with the concurrence and the technical assistance and counsel of our state health directors. They were able to self-attest on the basis of a number of factors that were unique to their county and their region. It was a recognition in California that's larger in population than 21 states combined, that one size does not fit all. None of us naive about that. We recognize the conditions across the state are unique and distinctive depending where you are across the state. And as a consequence, the modifications that we made statewide, we allowed for further modification into what we refer to as stage 2 in these 24 counties. We have been working very collaboratively and very closely with their health directors, and we have put those self-attestations up online at our covid19.ca.gov website, and we have allowed through technology, mapping technology, the simple ability for you and others not only living in the community but even outside the committee to check in to see how those counties are doing against their commitments, against their self-certification in terms of their capacity to test, to trace, to track, to isolate, to provide protection for the most vulnerable in their community, be it skilled nursing facilities, other congregate facilities, their capacity to deal with hospital surge and the like. Today, we want to update you not only on that progress, but also update you on the conversations we've been having with other counties throughout the state of California and their health leaders. We've been tracking over the course of the last 14 days by seeing a decline in hospitalizations by 7.5%, 7.5% decline over a 14-day period in hospitalization statewide. We have seen an 8.7% decline in the number of ICU patients over a 14-day period. The last few weeks, we've also seen an unprecedented number of masks be distributed, PPE, throughout the state of California. Tens of millions of masks now we've been able to distribute just in the last number of weeks since we've now moved into this next phase, phase 2 of our stay-at-home order. All of these things matter. The PPE is foundational to furthering our efforts to make meaningful modifications to the stay-at-home order. We were able, I mentioned this last Friday, to distribute some 11 million masks just on Friday to critical sectors of our economy, our farm workers, our grocery stores, to in-home support service workers, folks that are on the front lines across the spectrum, including child care workers and the Department of Education. More and more masks come in. In fact, the inventory this morning was 56.1 million masks that we now have in our possession. We were able to distribute some 46.1 million of those procedure masks. This is in order. Having appropriate levels of PPE is foundational in terms of advancing that cause. We also are significantly advancing the cause of increasing our testing capacity in the state of California. 1.3 million tests have been conducted to date in the state of California. 57,000 tests just in the last 24 hours. We have a very sophisticated tracing corps that is well established in the state of California. In every county in this state, going back decades, we have health departments that have professional trained tracers and trackers that deal with infectious disease spread, from HIV and AIDS to measles, TB, and the like. It was referenced just a few weeks ago that 23 counties actively had been participating in tracing COVID-19. We had a workforce of a little over 2,800 that were already trained at the local level, a robust workforce in that space. We now have been able to partnership with the UCs, but that cohort now is being replaced with an additional 300 that are entering into that training. So we're seeing that increase in terms of the capacity to have more tracers and trackers. We're seeing that happen in real time, and we're seeing the spread of that capacity in a very meaningful way. We are also looking to identify hundreds and hundreds of others in that training capacity. Up, or PPE up, and we're getting it out, and we are seeing a significant steady rate of decline over a long period of time in the number of people hospitalized and in our ICUs. All of those very good trend lines. Thus, the reason we're here today, not just to talk about the past and those 24 counties that have self-attested, but to talk about additional counties that we believe are in a position with more that in our additional modifications, we are moving forward to allow some of the larger counties to continue to make progress deeper into phase 2, and to do so effective immediately, but on their own pace. And I say effective immediately, meaning the guidelines are out there, meaning the processes are in place, but they can go at their own pace. We estimate roughly, plus or minus, again, it's a criteria that we're putting out. And you'll hear from Dr. Galley in a moment. He'll talk more specifically about that criteria. The criteria, though, is foundational in this respect, that we're really starting to focus in on the hot spots within counties, particularly in and around our skilled nursing facilities and those areas within the counties that remain the most vulnerable and challenging in terms of protecting people and protecting the spread of this virus. So we, in this next phase, are looking to redouble the efforts around those hotspots within those counties. As well, we are looking to advance some guidelines related to total hospitalizations, no greater than 5% increase over a 7-day period, and make sure that the tracing capacity is adequate to meet at least needs of 15 tracers per 100,000 population. Continue to make sure that the positivity rate, and this is a rate that I've brought up on a few occasions in the past, tracks at less than 8%. And what I mean, if you haven't been following the reference to positivity rates, that's the simple percent and that's the rate that we are tracking more and more closely. As the testing significantly increases, the attestations as we move forward as a rate that we are tracking very, very closely. And again, we want to see that rate below 8%. The focus from our health perspective. So that's the framework today, encouraging progress as we move forward deeper into phase 2 in the state. And I should just note that we are also looking forward in the next few weeks at a number of significant milestones that are worthy of highlighting. We expect, if we hold the rate of transmissions, we hold the positivity rate down, we continue to do justice to the hospitalization and ICU numbers, that we'll be making announcements statewide, not just with the regional variances, that would allow for retail not just to be picked up, but in-store retail to be loosened up. In addition to that, sporting events, pro sports in that first week or so of June without spectators and modifications and very prescriptive conditions also can begin to move forward. And a number of other sectors of our economy will open up again if we hold these trend lines in the next number of weeks. And that includes, for example, getting a haircut, which is very meaningful. And that as a be done on a regional variance, but it will be able to be advanced, we believe, in the next few weeks, even statewide. And so I want to just go back to that because I know it's an important one, the hair issues for some, and getting statewide. So I continue down this path, but I'm sitting here just 7 feet away from our doctor, Dr. Galley, who's been working overtime with the regions on all of these guidelines and these modifications. And
it's a pleasure to be here today to discuss the health directors, board members of boards of supervisors, who really came together over the past many all the state employees who have made this possible and have worked overtime to get the details right. So as the governor state is, focus on three distinct things. First, the data on the one hand. So those two data points are hospitalizations, looking at no that first metric around hospital. It is that one, or as the governor mentioned, our test. Community. So that is on the data and showing that counties are both doing what it takes to demonstrate on a 7th, where counties had to attest to having testing capacity of at least 1.5 tests per 1,000 people per day, or having 15 individuals in their county trained and doing contact but bringing them together, elevating best practices on not just protecting residents, but also protecting the workforce in the facilities, and having strategies to address challenges like staffing shortages or PPE shortages in those facilities. So working with not just the state leadership, but also the county leadership to partner with our skilled nursing facilities to work and protect a very vulnerable population, including those in the health field, need to have the protection very, very important. In addition, we are asking counties to work with their local hospital coalitions or hospitals themselves to demonstrate the ability to maintain a surge capacity adequate to respond to the needs of potentially a growing number of individuals who need care for COVID. The last element of these criteria that is very essential is throughout a county, we want to make sure that the counties have thoughtful plans to be able to and that if we need to reduce movement within a county for a period of time to reduce the number of cases that we're seeing, that we have the strategies and ability to do that. So as the state, we are certainly looking forward to working with our county partners to make sure that this can be done as safe as possible, and especially as we to receive data on a very regular basis, and on our state COVID-19 website we will have links to county-specific data that shows how each county is doing as it relates to cases and hospitalizations and testing numbers, so that we can keep you informed on your local conditions and conditions throughout the state. So we continue. The state have experienced COVID-19 in different ways. Different counties have prepared differently over time, and acknowledging that county leaders and county health officers have a very strong and historical responsibility for guiding their counties. And with the support of the state, we are confident that we can begin to do this in a safe and modulated way, that we can come back to you in the next many weeks with additional sectors and the guidelines for those sectors to open back up. And all the meanwhile watching closely the data, so if we have to make any other changes to reinstate some of those stay-at-home orders or other modifications, that we will be able to do that in strong partnership with our local partners and local leaders. So with that, I'll turn it back to the governor.
Thank you, Doctor. Bottom line is people can go at their own pace, and we are empowering our local health directors and county officials that understand their local communities and conditions better than any of us. At the same time, we need to hold all of ourselves to account, transparency, real accountability in terms of the application and the implementation to presuppose and as I express the localism frame, let me also respect that decision-making at the local level. The Bay Area is in a different position than some parts of the state. LA County is in a different to and begin the process of making subsequent decisions to move more broadly into other sectors of our society. I should note that we are also working with faith-based leaders, and I want to just express my deep admiration to the faith community and the need and desire to know when their congregants can start once again coming back to the pews, coming back together. We'll note that the order that we put out today will allow in a phased approach, looking always update in terms of what guides our thoughts and our strategies. And once again, those are the issues. 24 hours went up modestly, 0.4%, and tragically, we lost 41 lives over the last 20. Possible spread. The testing, again, capacity is increasing. I want to encourage you to go to the covid19.ca. more sites are going up. As examples. Again, these are starting to roll out, and we encourage you to make a reservation.
Reporter at KCBS Radio in San Francisco, and I'm the pool reporter today, asking questions on behalf of my colleagues around the state. And
It's a rough estimate, and we'll provide. Smallest state in this country. I began my
areas. What has fundamentally changed about the spread of the virus?
on the hospitalization, the ICU rates, because that is a particular focus. I mentioned on May 7th that the increased, the number of ICU patients has decreased. Ali said around skilled nursing. Since May 7th.
Rachel Becker with Cal Matters. You mentioned that now
Excluding communities that may not be willing to test.
and there's also quite a few about houses of worship.
We are within a few weeks of some meaningful modifications as it relates to houses of worship.
parking lots, since many people are being forced to park along highways. This virtually
that we are looking to engage the legislature. And with the people of the state of California to make the best. Delivery in this state that have kept this country moving. That's de minimis compared to the cost. Know a little bit about the local government responsibilities. Know no one should be surprised by that, but I am not here for by any stretch of the imagination.
and what do you envision?
Well, that's deep. In this respect, we're just talking about the opportunity. Representatives from all the major league sports and working with our collaborative through the Western. With that, I want to just thank everyone.